Hello, my name is Sam Feltham and welcome to Expert Interviews here on Smash the Fat. With me today is Dr. Adam Nally, who is a board certified family physician and a board certified medical bariatrician. I was trying to get that right, Doc, with a private practice in Arizona and absolutely loves it. He's got a whole load of other accolades as well, which we're going to get into. But before all of that, how you doing, Dr. Nally?
Very well. It's a pleasure being with you this morning. I guess it's this morning here. It's this afternoon there, isn't it?
Yeah, that's spot on, spot on. 4 o'clock here, 8 o'clock in Arizona. So yeah, it's fantastic that we could get you on the show so early. Really appreciate your time. Now, as I was saying there, you have a lot of accolades to your professional career. So let's start off by getting into why you became a doctor and kind of where it's led you to be today.
Well, I have always loved science and the aspect of helping people and the physiology of the body has always fascinated me. The combination of being able to help people, being able to work with people together, and apply science is one of the reasons I became a doctor. It's one of the reasons that I got into this. It's a career that is actually very rewarding and very enjoyable because of neat people I get to meet every day.
Absolutely. It's kind of a common thing that it is about passion for helping people. But your career has seemed to have led on from kind of your original doctorate, which was osteopathic. Is that correct?
Yeah, I'm an osteopathic family practitioner, so I'm a DO essentially. I practice family practice medicine and also trained in osteopathic spinal manipulation as well as part of my specialty. After being in practice for a few years, I started realizing that about 2/3 of my practice was struggling significantly with weight gain, elevating their cholesterol, increased blood pressure, and having the same problem myself. My father was diabetic. He weighed almost 400 pounds when he passed away, and he passed away at 58 from a major complication due to diabetes. He had a quintuple bypass and had 3 stents placed, had some significant health problems. And unfortunately, I've got his genetics, and I was going down the same path. And my labs looked like his labs when he was my age. I was running triathlons and having trouble with weight loss myself, applying the techniques that I've been taught to apply for medical school. And so one of the challenges and the reason I got into bariatric medicine was because I was seeing the struggles myself, and my patients were seeing the struggles. We were eating low fat diets and restricting calories and exercising our brains out. I had patients coming into my office who were restricting their calories down to 1,000 a day and exercising for an hour a day, 6 days a week, and still gaining weight. And so that's what led me to search out why it is we were not being successful with weight management, with cholesterol control. What really pushed me over the edge is one day, about 8 years into practice, I had a sweet lady who had followed me from residency who came in, and I had diagnosed her with diabetes the year before, and she came into me, and I reviewed her blood pressure with her and her cholesterol and added another blood pressure pill. And she says, Dr. Nally, I've been seeing you for 8 years, and every year I see you, you add a new pill. And that bothered me. And so that's what led me to pursue a better understanding of why it is we actually gain weight, why it is we have an elevation in our cholesterol, and why the traditional approaches have not been real successful with the majority of the people.
Absolutely. And that kind of led you to the Bariatric Society. Is that correct?
Yes, it did. I found the American Society Bariatric Physicians, and was just amazed by the training that they offer, the continual medical education that they offer, and the fact that it was all evidence-based, and everything that they were showing there was cutting edge, the newest stuff coming out, the newest research, and gave those that were attending as physicians the ability to apply the techniques in real time. And as I began to apply some of those techniques that we were seeing, I began to see some dramatic success, and dramatically changed my practice approach to the treatment of diabetes, hypertension, cholesterol, and weight. And I've had great success in the last 7 or 8 years that I've been using the techniques that I've learned through that society and through my relationships with other bariatricians around the world.
Absolutely, and you've kind of collated this experience on your website and blog, which is freely available at docmuscles.com, and that's kind of how I became aware of you. I was told by Emily Maguire, who we had on the show a few weeks ago, who's an obesity scientist and a nutritionist as well, to get in contact with you, and so I checked out your blog. The first blog that I read was Stress, the Weight Loss Killer. And it really clearly and concisely described about how stress kind of affects our weight loss and weight gain. So let's kind of get into the meat of that. How on earth does stress make us lose weight or gain weight?
Well, stress is an important factor. The muscles improve when we stress them. The body is designed to handle stresses, and it was designed to function that way. However, what happens is stress releases a series of hormones, including adrenaline and cortisol, and a whole cascade of endocrinological hormones that flow through the system. The challenge is that stress in general, when prolonged, stimulates a cascade of hormones starting at cortisol, and in both the brain and the adrenal glands, which pushes the body to produce an abnormal insulin response, and thereby start depositing fat in an abnormal way. To make it simple, we're designed with a fight or flight mechanism. If you're out in the woods and a bear rears up in front of you, your body has a flood of hormones that shunt the blood to the muscles and to the heart to allow you to run from the bear, fight the bear. The challenge is that in our daily lives, we don't have bears. We have multiple stressful episodes. We've got a boss, or a long drive from work, or a rough telephone call, or we also have multiple social media sites that are bringing us information at rapid pace that oftentimes we're not prepared to deal with, and some of those that are stressful. That chronic elevation in stress causes the cortisol levels to rise. That thereby stimulates a response in insulin and actually suppresses the thyroid function, and you start to see deposition of fat into the what we call the visceral tissues, the abdominal region around the stomach, around the intestines. You start to see that apple-shaped belly start to arise with chronic stress. And as long as that cortisol level is turned on, you're getting a high insulin load, and that high insulin load prevents you from being able to lose weight or drop weight.
Absolutely. Again, very clear and concise, Doc. I love it. What is it that we can do about all of these stresses that come into our lives? Because it's very, very difficult to try and avoid social media, and avoid anything kind of stressful in life. What can we do to try and reduce this?
Well, I just posted a blog this morning. I don't know if you saw it. I've been looking at burnout as an issue. One of the things that the physicians struggle with, and I'm the president of one of our medical societies here in Arizona, and I've had a few physicians come to me asking about, well, doc, what do we do about burnout? And stress and burnout run together, and a lot of the times there are things that you can do that actually really do help. So look at my article there on burnout. That'll give you an idea, number one. But some of the things that I would look at first is there are some anchors to your stressors. There are some things that you do on a regular basis that cause you to worry. I have found that just some simple journaling practices, writing down what those stressors are each evening, and then looking at them and looking at, okay, what can I actually do to fix that stress and remove it from my life? So journaling is very effective, both for patients who are trying to lose weight and just to take the anxieties and put those on paper. And sometimes just being able to put them on paper takes them out of your mind and decreases that worry. Some patients have got some underlying anxiety or depression that's going on, and you may want to talk with your doctor about that, and there are some medications that can help control those stressors in that regard. What we're finding is that we're always on. Like my son, I've got a 16-year-old son who loves his phone, and I've got to at times almost take the phone away because he'll be on it all night long if we let him. The challenge is that because we're always on, with social media, we never give ourselves downtime, and so we have to schedule real play and real downtime. One is when you're getting ready to go to bed, take your phone, plug it in across the room so it's not accessible and you can't get on Facebook and check all your friends at midnight. Schedule a regular time to go to bed. That's a big factor that I find a lot of people aren't doing. Go to bed the same time, get up the same time. and then schedule in some play. One of the challenges I have found as a physician is I work long hours, and it gets to the point where I don't schedule the play in that I need to. And I have the luxury of having some horses at my home. We have property that we board our horses at, and so I have to schedule time to go out and ride my horse. That actually is very relaxing for me. So I would recommend finding something that you like doing. Think back when you were a child. What did you do that you really liked doing when you were a child? And then do that. For 30 minutes or 60 minutes once a month. Just go out. Important to get out into nature, to experience the outdoors, to breathe the fresh air, and that actually dramatically decreases that stress to some degree. And then lastly is I recommend well, two more things. One is meditation. I find that meditation is very helpful, or prayer. Just finding a very quiet place and for 10 or 20 minutes, sit and listen to your thoughts. That scares a lot of people sometimes, but as you start to listen to those thoughts, and you actually find that there are certain things you worry and think about, and that really does help. It does help control that. Lastly, is in a low-carb diet. I'm finding significant benefit in regards to people's overall sense of well-being as they back the starches out of their diet and the carbohydrates, and they increase the good fats. Increasing those good fats increases your access to vitamin Ds and all the vitamin Bs. And that low-carbohydrate diet, high-fat, low-carb, moderate protein, is really effective in eliminating and decreasing the overall sense of stress and sense of anxiety.
Yeah, it is. It's amazing how much diet kind of impacts the body, and it kind of also controls your behavior as
Very
well.
much so.
Because if you're eating foods that are driving cravings, for instance, then you're going to stress out about not having, for instance, sugar, chocolate, any sweets or candy or anything like that. But if you're eating foods that are just keeping in you what we call biochemical balance, where you don't have these kind of cravings or addictions or anything like that, then you're not worried about any of that sort of thing, and there's no real stress on the brain either.
Very true, very true. It's amazing. Some work by Robert Lustig, he talks about the hedonic effect of carbohydrates and sugars. What I've found is very powerful is when you are insulin resistant or diabetic, even pre-diabetic essentially, your body's producing between 2 and 10 times the normal response to insulin. And table sugar, when it's metabolized partially through the liver, produces a byproduct or an aldehyde that actually acts just like morphine on the brain. So 2 or 3 hours later, after you've had that high fructose corn syrup, you're craving it again, and it has just as powerful an effect on the brain that morphine does, or morphine withdrawal. So I have patients that come into me all the time that they're hooked on those carbs, and when they back those off within a week, they feel dramatically better. But they will go through a sense of withdrawal because of the effect of those sugars and that hedonic effect of addiction that sugar does play a role in many people's lives.
Yeah, absolutely. It's pretty devastating. But as you say, if you kind of keep the carbs away just for like a week to 3 weeks, then you tend to be able to get over that essentially, and kind of the withdrawal symptoms really kind of come off, and then you're able to eat real food again.
Exactly.
Precisely. And one other thing that you kind of mentioned there that is crucial to stress management is sleep.
Yes.
Which is probably the most underrated weight loss tool out there. So it sounds quite crazy to anybody that's never really thought about it before. But lying there doing nothing, closing your eyes is probably one of the most best things that you can do for your health.
It really is. That sleep allows your body to reset its hormone milieu, to put it that way. It resets itself. The cortisol levels drop and fall overnight, and then cortisol normally rises in the morning to wake you up. But as you allow yourself to sleep, it allows that biorhythmic pattern to reset itself. It allows your body to burn off those hormones, and it allows your mind to put at ease and to rest from all the busyness of that day. There's a number of books and studies that I've read that actually even recommend a 20-minute power nap in the afternoon if you have the luxury of doing that. That simple power nap plays a huge role for many people in recovery. And I've got a couple patients that when they started just getting adequate sleep and taking a power nap, the weight came off, and that was one of the struggles they were having. They had plateaued out on their weight loss, and as soon as they started getting adequate rest, all of a sudden the weight came off.
That's awesome. That's awesome. And how do you get good sleep, and when do you think is kind of the optimal time to have that best sleep?
You know, they've argued about that for years, and there's been a few studies I've read that show that you can actually get adequate sleep. You know, anywhere between 6 to 8 hours is the average. I saw a small study published yesterday actually that said the ideal amount is 7, but again, it's no one has an actual amount. You need as much sleep as you need, and your body will tell you what you need, and you'll wake up when you're rested. The ideal thing is that you're going to sleep at the same time. Your body gets used to a cycle. And again, those hormones follow a cyclical pattern. And so as you can go to sleep at the same time and get up at the same time, whether that's 8 o'clock at night or midnight, and then get up at a different the same time in the morning, you're going to find that your body over a period of 1 to 2 weeks actually that cyclical recovery starts to return. Now, some people have to work shift work where they get sleep at 3 hours in one part of the day and then maybe 3 or 4 hours in the after part of the day. They actually did studies to show that actually is adequate to getting a solid 6 hours. The challenge, though, is you've got to have at least 3 to 4 hours of unabated sleep. If you break into that sleep cycle within that 2 or 3 hour window, though, you may be having a problem. I've got some older patients that have incontinence or have prostate issues, and they're getting up 3 to 5 times a night. That break in their sleep cycle itself to get up to use the restroom ends up affecting their cortisol level and makes it difficult for them to lose weight as well. So anything that's keeping you from having good sleep is a problem. Had one patient a few weeks ago, her dog wakes her up 10 times a night. She can't lose weight. Well, what's the answer there? Put the dog in the other room. That's it. That's the best way to do it. She didn't want to hear that, but it's affecting her ability to lose weight. And so that's one of those challenges you got to look at. You need to have some consistent sleep for at least 3 hours to get into that stage 3 and 4 sleep and let those hormone levels drop to normal.
Absolutely, absolutely. Trying to create a normal circadian rhythm, which is just your 24-hour cycle of hormones. For anybody that doesn't know what that is just so important. And there's so much more research coming out that shows a disruptive circadian rhythm is just the worst thing for your health. Now that in itself, kind of saying statements like that, can add to the stress almost, and you start worrying about the health, and you end up in this vicious cycle. So what's kind of your advice when it comes to that sort of vicious cycle of worrying about health concerns?
Well, the challenge is if you're worried about health concerns, that's where that journaling comes into play. I find that for me, there's a number of things I'm worried about the next day, and if I just sit down at night and I plan out my day and I write out a little journal, this is what I got to do, and then these are the things I'm worried about, and these are the things I need to do about it. The fact that I've actually taken my pen and put it on paper somehow takes it out of my mind and puts it on that paper, and then I can actually sleep more restfully at night. I find a lot of people have that effect too. If you're worried about your health, journal about it, write about it, and put it on paper. Let the paper hold the worry, and then you can sleep normally that night. And we find that technique seems to be very effective for a lot of people. And if that's not working, then talk to your doctor about some help with sleep and help with the worry, because sometimes there's a serotonin or a norepinephrine issue that we may need to address with you that may be genetic. That's a simple medication may actually be able to help solve.
Absolutely, absolutely. And one thing that I've tried to sort of instill in our campers and members at different locations is the formula E plus R equals O, which means event plus your reaction equals the outcome. So you've got to kind of take it as it comes. Just try not to overreact and do things like you said there, journaling about your daily experiences, so then you can process the information in a better managed way.
Yes, very much so. I have a friend he's been journaling for probably 25 years, and he has a very stressful job. He's an attorney, and I asked him, well, how do you journal every night with all the crazy stuff that goes on through the day? And he's got kids and he's got a busy job and all those things. And he tells me that what he actually does is he just puts a little bullet point on a piece of paper, and just putting down that bullet point, he'll go back on the weekend and then kind of fill in all the details as a journal or as a diary. But just bullet pointing some of the things that you did or some of your worries that day, bullet pointing your meal planning, things of that nature, is really, really helpful. It really is.
Yeah, absolutely. Yeah. Failure to plan is a plan to fail, as they say, for sure. And then another interesting thing that you said before was about meditation, and that's something that we kind of advise people to at least attempt, because it can sound a bit crazy to people that have never tried meditation before. Is there any particular type of meditation that you advise?
Well, I'm a religious guy, so I and my family, we pray. We pray twice a day, and one of the things we teach my kids with prayer is to think about what you're going to be praying for. That it's a form of meditation. Now, I also find that in school, just sitting, closing your eyes for 10 minutes, finding a quiet place that you can either sit or kneel, and then just listening to your thoughts. Now, initially that sounds funny, but as you listen to your mind, there's a lot of motion and commotion and calamity going on in your head back and forth. And as you begin to listen to that quiet and the noise that's there, you begin to see patterns that are happening, and it actually helps you become more creative. It's amazing when I ask people to do this, how often there's a television on or there's a radio on in the background that does not allow them to let their thoughts process through. And so it needs to be where you turn off the radio, you turn off the TV, you turn off the feeds that are coming in, and just take 10 minutes, close your eyes. You might fall asleep, you might not. But you'll be amazed at what your mind will process, and the creativity that can come from just allowing yourself to let your mind kind of decompress that way.
Absolutely. One thing that I do myself is that I use a walking circle. Actually, it's just there's a small park just outside my block of apartments, but I literally just walk around like a small bit of the park just to kind of help me process thinking. There's kind of some relative science behind walking and thinking is kind of connected, helps you process the information. So even if it is just either praying or just sitting in a quiet place just thinking about your thoughts, or whether it be just getting outside and just going for a walk for 20-30 minutes just so you kind of by yourself, is kind of advised, because if you're chatting to someone, you're not going to be able to process your thoughts so well. But just doing that just helps out so much in terms of being able to process that information.
It really does. Absolutely.
Straight up. Now, we do have one question that we've kind of covered already from Patricia on Facebook, who asks, since your topic is on stress and how it is a weight loss killer, what are you incorporating into your practice that focuses on how to reduce stress? Kind of covered that. Do you have any suggestion for stress reduction techniques, and have you considered coming up with a hypnotherapy CD specifically geared toward weight loss and stress reduction?
I'm not a hypnotherapist, so I haven't really thought about a CD for that. I know they do exist. I know I've got a couple patients that have tried them and they've worked. I've had a couple patients that have tried it and they haven't worked. Yeah. So I think it really depends on the hypnotherapy. There's data to show that it's helpful, especially with some of that habit forming and the patterns that are there. Really, hypnotherapy is effective in breaking the cycles of bad habit, bad pattern. So if that's something that is necessary, that's something you can seek out. Now, unfortunately, in my practice, because I'm not a hypnotherapist, I don't do that. But if a patient is interested in that, we can try to find a counselor or a hypnotherapist that does that. And then I know there's a number of books that are out there on self-hypnotherapy, and really that kind of runs along the border of meditation. And so I would suggest looking at that. In my practice, again, like we've talked about, I encourage those 4 or 5 things we've already talked about in regards to stress reduction. And a lot of people will find something that they do themselves that is a stress reliever for them. And so usually it's a one-on-one thing that I do with my patients. I haven't really done anything to answer the question in general. I haven't add any fancy CD or book to that point. But that's a good thought. I'll ponder that.
Yeah, absolutely, absolutely. Because hypnotherapy doesn't work for everybody. Works for some people, and so do other things as well. So it's kind of just like everything else in life. It's a bit of trial and error, trying to find avenues that are going to reduce your stress, and if you reduce your stress levels, then in turn you're going to reduce your cortisol levels and your insulin levels, and you'll start to store less fat, and your weight loss will continue for sure. Is that a good way to put it, Doc?
You summarized it perfectly.
Awesome, awesome. Thank you so much for your time today, but we've only got one more thing to do, and that's to hear a smash it out from Dr. Adam Nally. So on 3, I want you to shout "smash it out" to the camera. So 1, 2, 3.
Smash it out.
That's awesome. Well, people can check out Dr. Adam Nally's blog at docmuscles.com. Also, you can follow him on Twitter at docmuscles. And then what was your website address for your family practice?
It's
people are in Arizona.
NallyFamilyPractice.com altogether. NALLY FamilyPractice.com. That's my family practice website.
Ideal. And were there any other links that you'd like to share with the audience?
No, just those 2 are great for now. You can link to everything else from those 2 sites. So.
For sure, straight up. And were there any other wise words that you'd like to give our listeners at all?
Oh, just enjoy the journey. That's one of those challenges that I've been learning myself. But enjoy the journey. That's I think the best piece of advice to decrease the stress.
Absolutely, that's a great attitude. Fantastic, Doc. Thank you so much for your time today. If you'd like to come back on the show, we'd love to get you back on in the future.
Anytime. It's a pleasure talking with you, Sam.
Perfect. Thanks, Dr. Nally. Take care.
Thank you. Okay, bye-bye.
Bye.